We've averaged 88,000 tests a day. I don't know many states that can lay claim to that. We have a responsibility to do more. I want to make that clear. We tested over 101,000 people yesterday. A few months ago, we were testing less than 2,000 people a day. So we're getting a better handle on understanding community spread. But you're absolutely right. We have a responsibility to do more. We want to encourage Congress, encourage the President and others to help support that effort at a federal level as we scale our testing. 3.7 million tests. We certainly have a responsibility to increase not only the total number of tests, but who we test and how we test. And what I mean by who and how is to make sure that we are testing our diverse communities, and how I mean that we encourage people that are in high-risk situations to get multiple tests, not just to be tested one time and feel relieved by perhaps a negative test, but to encourage people to continue to be tested if they indeed put themselves in a position where they're vulnerable to contacting COVID-19. As it relates to contact tracers, you're right. We made a commitment to you and others that we would train up to 10,000 contact tracers in the state. We announced that a number of weeks ago. We announced a partnership with UCLA and UCSF to help us with that training. They have done a magnificent job. Their expertise is legendary, and that tracing training continues. We have a cohort of existing contact tracers in many counties, and you're right to note, not in every county is that cohort as robust. Some of the larger counties have well-resourced contact tracing that predates COVID-19. Others are putting together their contact tracers. We've aided that effort not only by the training protocols through UCLA and UCSF, but also the platform we put together with Accenture, with Salesforce, and with Amazon. It's a contact tracing platform that is very familiar, not just here in California, but in other states like Massachusetts. I noted on a slide yesterday how many counties now are already participating in that platform. 5 more joined us yesterday. Many more will join over the course of the next few weeks. We're well on our way to coming close or exceeding. We'll see where we are in the next week of reaching our first phase goal of 10,000 as cohort trained as contact tracers. And we'll continue to do more to advance even more training opportunities. And as you know well, we have now encouraged through HR in the state of California to identify a cohort of state employees that we can train so that we have true representation and distribution of contact tracers throughout the state of California and can meet that goal. As it relates to mitigating the spread, look, we're at 5.1% positivity rate over the course of the last 14 days. That positivity rate has gone up. It is certainly below the 8% that we prescribed as it relates to some of the attestations in some of the counties. It is an obvious cause of concern, and I have made that crystal clear today, yesterday. I've made that point on multiple occasions, and we're monitoring that in real time. There were 6 indicators around testing, contact tracing, protecting vulnerable communities more broadly defined than just those in skilled nursing facilities, but also those in congregate facilities, including our homeless, including people in custody. We, of course, need to do more on therapeutics, another indicator, but I'm very pleased we have a remarkable team of advisors in the therapeutic space, and we continue to be very hopeful about therapeutics beyond just remdesivir, other therapeutics that are entering into the discussion, into people's consciousness, another indicator that we're advancing. Another indicator, of course, is the ability to toggle back. I talked about the dimmer switch just a moment ago, ability to pause. I talked about what Disney rightfully just did and why we're very grateful for their recognition of the current growth and the total number of positive contacts. So, look, we are working through this, but nothing is more important than you and others to practice the kind of physical distancing and face coverings that can truly help guide and advance the effort of working through this in a way that can truly mitigate the spread as we have reopened our economy.